Hi, and welcome back to Psychology with me, Mr. Snyder. And today we are going to delve into the idea of our stress in our lives, our health, and where those stress feelings come from, stressors. So we're going to define stress, talk about the sources of stress, and then the consequences of stress, both psychological and physiological. So what is stress? Your definition, we all know what stresses us out. We feel stressed out, but what is stress? It's the physical, emotional, cognitive, and behavioral responses to events that are appraised as threatening or challenging. And it can come in three different forms: physical stress, emotional stress, and mental stress. Physical stress symptoms include being tired all the time, not sleeping well, becoming frequent colds, suffering from the common cold because the stress can weaken your immune system, chest pains, and nausea. The emotional stress can be pictured as anxiety, depression, fear, anger, irritability, frustration. And mental stress means you can't really remember stuff, you have problems concentrating, you have a lack of humor, and you have problems making decisions. So if you are under stress, people tend to behave in these situations differently. They may eat too much, they may cry, or they may lash out and hurt other people. Now, what do we call events that cause us stress? We call them stressors. Stressors can come from within a person or from an external source, and they can be mild or severe. Relatively mild stressors may be being delayed for some reason, having to wait in line, rude people, losing something and not being able to find it, to severe, and we're talking about catastrophes like hurricanes, fires, crashes, or combat during war. Stressors can also be imaginary, like the student who puts off opening a report card and then it's not as bad as they think, or a parent who imagines what can happen to their teenage child when they don't come home from an evening out when really they're just missing curfew. Stressors can be, there's different kinds of stressors, two different kinds. So there's distress and eustress. Distress is mild to severe experiences, bad news, things that are bad. Think of it as bad stress. Eustress is a good kind of stress. It's positive events that happen that require your body to adapt or change. And change and adaptation is what early researchers felt was the underlying causes of stress. So like starting college, that's a great thing, but it also can bring on a lot of stress. I know getting married can bring on a lot of stress for both men and women. Earning a job promotion means more responsibility, which comes with more stress. So stress researchers today have redone their definition of eustress to mean the optimal amount of stress that people need to promote health and well-being. So a little stress is good. What are our sources of stress? Well, it can come from our environment, such as life's ups and downs, or social factors. Let's delve into the environmental factors first, like a catastrophe, which is a large-scale, unpredictable event, and it creates tremendous amounts of stress and feelings of threat to your well-being, such as wars, hurricanes, floods, fires, airplane crashes, terrorist attacks, other disasters such as that. Ordinary life experiences also require a person to make adjustments and changes, and so that can come from your environment and cause stress as well. There's different ways to measure stress. One of them is the social readjustment rating scale, which measures your amount of stress by having you add up life units that are associated with each of the major events listed on the scale. So in the past 12 months, you go through the scale and see if things have happened to you that are stressful, and you add them up, and it will tell you the degree of stress experienced by that person. So 150 to 199, you're having a mild life crisis. 200 to 299, you're having a moderate life crisis, and 300 and up, you're having a major life crisis, which means that you are more susceptible to illness, mentally ill, physically ill, and having accidents. If you look here, Here are some, but not all of the items from the social readjustment rating scale. You can see death of a spouse, divorce, marital separation, jail. Those are the ones high on your list. A scale that maybe you're more interested in for people your age is the college undergraduate stress scale. It can measure the amount of stress in a teenager or young adult's life by having you add up life change units, which may be more associated with your age, such as rape, the death of a close friend, an STD, final exam week, flunking, peer pressure, homesickness, falling asleep in class. That might not be stressful in itself, but it does bring on stress after that to get caught up. Dating concerns, other things. So if you're more interested in this, you can look at the college undergraduate stress scale. Those are not the only events listed on it, but you can add up your stress level. There's also a hassle scale, and we would define hassles as just little frustrations, delays, minor irritations, annoyances that bring on stress. And we'll define frustration here in a second. So the scale measures the above mentioned type of stressors and has you rate them on 0 to 3. So misplacing or losing things, having troublesome neighbors, those are things that are little frustrations and hassles. Social factors. Let's switch over to social factors. Those could be poverty, such as like overcrowding, lack of medicine, disabilities, job stress, which could be the workload that you have, the lack of meaningfulness in your work, lack of control over your decisions, long hours, poor working conditions, etc. And if there's stress coming from these things, it can create what is called burnout, which is negative changes in your thoughts, emotions, and behavior as a result of prolonged exposure to this stress. Like extreme dissatisfaction, pessimism, lowered job satisfaction, you want to quit. A lot of people lately say the burnout among teachers is high in the past decade or 2 decades, and a lot of teachers quit and get burnt out in the first 5 years and then want to move on to something else. If you're from a different culture, that can be a sense of stress trying to fit into another culture. So we call that acculturation, which is adopting or adapting to a new and different culture, one that is often more dominant than yours. You don't have any semblance of your culture anymore. And acculturative stress is the stress that comes from the need to change or adapt to this new culture. And there's a couple different methods that happen that can create stress. Integration is when the person tries to maintain their original sense of culture while also trying to form positive relationships with members of the dominant culture. Assimilation is the minority person giving up their old ways and completely adopting the majority culture's ways. The U.S. government tried to assimilate the Indians in the late 1800s. Separation would be the minority person rejects the majority culture's ways and tries to maintain complete ties to their old identity. And then finally, marginalized is when the person neither maintains contact with their old culture or their new culture. So what are some psychological factors and consequences of stress? Well, you can feel pressure. People feel they must do more work faster and work harder at it. A lack of control the person feels. The less control a person has, the greater the degree of stress. And a frustration we define as when a person's goal or fulfilling a need that they have is blocked from being achieved. And these could range from external or internal frustrations. External is stuff you really can't control, like being stuck in traffic, being cut from a team, losing your wallet. Those are all external factors, while an internal frustration, also known as a personal frustration, is when your personal goal or need cannot be attained because of your personal characteristics. Like if you want to be an engineer but you have no math skills, or like me, if you want to be a movie star but you're not attractive. We all have different little internal personal frustrations. This can cause two types of disorders recognized by the DSM-5. They have acute stress disorder, which is severe, but it's only acute in the amount of time that it lasts. So it is suffered by people who experience a traumatic event, one that most of humans don't go through in their lifetime. And post-traumatic stress disorder lingers on and on and on. It's the same level of seriousness, but it just lasts longer. And it's more than 1 month. So people from wars very often suffer post-traumatic stress disorder. People in combat, in wars, traffic accidents, crimes, these can all cause post-traumatic stress disorder. Now, Hans Zellier came up with something called the general adaptation syndrome. And this, we talked about this before, but we're going to go a little more in depth on it right now. It is a 3-stage sequence of physiological reactions that your body does in order to adapt to a stressor. And it's 3 stages. So the first one is alarm. The body first reacts to the stressor by possibly, and this can cause fever, nausea, or headache. The second stage is resistance, and the body goes into the sympathetic division activity, the fight or flight. The body fights off or resists the stressor, and this could cause insensitivity to pain during this stage. And then the third stage is exhaustion. When the body's resources are gone, this can lead to stress-related diseases, and a weakened immune system and high blood pressure are effects of those. Here, let me show you this visual. You can see on the right where the first stage, we're below our normal level of resistance to stress, but the shock raises it, and then during the third stage, it cools back down, and the parasympathetic nervous system takes over. During the alarm stage, your sympathetic nervous system is activated by your adrenal glands pumping adrenaline into you. Your forehead, neck, shoulder, muscle, and leg muscles contract. Your pupils enlarge so that you can see more and be more alert while you're under stress. And sugar is released for energy. During the resistance stage, your breathing is frequent and shallow, your blood pressure remains high, your heart rate is accelerated, which means increased blood flow to muscles, and the hormones from the adrenal glands are being released into the bloodstream. And then when the exhaustion stage occurs, your liver runs out of sugar, and you have prolonged muscle tension and fatigue. Other effects of stress on your health are coronary heart disease, which can be the building of a waxy substance called plaque in the arteries of your heart, and this could lead to heart attacks or strokes. Cancer. Stress has been shown to depress the release of natural killer cells, which makes it hard for the body to fight any cancerous growths. And excessive weight gain can happen with stress. One chronic illness can lead to another, so weight gain, another disease that goes along with that is diabetes, especially type 2 diabetes, or diabetes, however you pronounce it. And hormones help play a role in helping the immune system fight off the effects of stress, and a hormone is known to provide anti-stress benefits in animals. It can also aid humans in stress toleration, and it regulates the effects of stress on the hippocampus in your brain. And the field of study that studies all this is psychoneuroimmunology. Say that again, psychoneuroimmunology. This concerns the study of psychological factors such as stress, emotions, thinking, learning on your immune system. So that's all I have today for how stress can affect you. Hopefully that you know more about it. You can control it a little more. Be sure to bring back those learning targets to class, and I will see you then. Bye-bye.